Newborn jaundice is when a baby has high levels of bilirubin in the blood, a yellow substance that the body creates when it replaces old red blood cells. The yellow color sometimes begins on the face and then moves down to the chest, belly area, and sometimes babies with significant jaundice feed poorly and are extremely tired. Your pediatrician will visit you and your baby daily and will request a blood test for jaundice if they feel it is necessary. Treatment is usually not needed. Keep your baby well hydrated with breast milk. Frequent feedings encourage frequent bowel movements, which help remove the bilirubin through the stools. Do not give any water, as this slows down the elimination of bilirubin in the body. Jaundice is generally not dangerous, but call your baby's healthcare provider if the skin is bright yellow, it continues to increase, lasts longer than 2 weeks, or other symptoms develop. Cradle cap is flaky, dry skin on your baby's scalp that looks like dandruff, or thick, oily, yellowish or brown scaling or crusting patches. You might notice the same condition around the ears, eyebrows, eyelids, armpits, and other creases. Cradle cap is not caused by poor hygiene or allergies, but rather by colored or perfumed cleansing products. Rather make use of a soap and perfume-free cleanser. It's not contagious, and it won't bother your baby unless it gets severe. Then it might itch. It's not necessary to do anything, but if it bothers you, you could try gently massaging your baby's scalp with your fingers or a soft brush to loosen the scales. Shampooing daily, but be sure to rinse out all the soap or shampoo. After shampooing, gently brush your baby's scalp with a soft brush or a terry cloth towel. Using baby shampoos developed especially for cradle cap. Eczema can affect babies in various ways, from slightly red skin to relentless itching. It is dry and makes your baby's skin less effective at protecting from fluid loss, heat, cold, and bacterial infection. It's essential to continually moisturize your baby's skin. Normal skin can take care of itself. It's flexible and water resistant and prevents any bacteria or foreign bodies entering the body. People with eczema normally have cracked, dry skin, and because the protective layer is broken, skin is easily irritated. Different allergens trigger the immune systems of different sufferers. Certain chemicals like alcohol, perfumes and scented soaps, clothing and other fabrics, animal hair, mold, pollen and dust, very hot or very cold weather, certain food groups such as dairy. Even once-off exposure to allergens can cause a reaction. Use hypoallergenic skin products with no soap and additives. Breastfeed or speak with your healthcare provider about alternatives. If your baby has a nappy rash, the skin will look red and inflamed where it's been in close contact with the nappy. The rash will probably affect your baby's genitals, thighs, and bottom. If it isn't treated, it can develop into something more serious, such as a yeast infection like thrush or candida, or a bacterial infection. The main cause is wetness in a nappy. Even the most absorbent nappy leaves some moisture on your baby's delicate skin. Try the following, and the rash should clear up. Keep your baby clean and dry by changing the nappy frequently. Clean your baby's bottom with fragrance-free and alcohol-free baby wipes or a mild soap-free cleansing lotion. Apply a thin layer of barrier cream or ointment before putting on a clean nappy. Give your baby as much nappy-free time as possible to allow fresh air to aid healing. In 1954, a doctor described colic as healthy and well-fed babies who suffer from irritability, fussing or crying that lasts for a solid 3 hours a day, 3 days a week for 3 weeks. Most babies cry 2 to 3 hours per day, but it's usually spread out during a 24-hour period. The crying or fussing usually begins after a feeding and is loud and continuous. Your baby's belly is sometimes distended or prominent, the legs flexing and extending, the feet are often cold and the hands clenched. The episodes can occur at any time of the day or night, but typically they begin in the late afternoon or early evening. Infantile colic begins at about 2 to 3 weeks of age, reaches its peak at 2 months, and is gone by around 4 months. There are certain factors that may worsen colic symptoms. Overfeeding in an attempt to stop the crying. Excessive anger, anxiety, fear, or excitement in the household. As soon as you suspect colic, consult your baby's doctor. There are no tests that can confirm colic, but it is important to exclude other causes of sudden onset screaming in a newborn. They have a healthy sucking reflex and a good appetite, and are otherwise healthy and growing well. Call your doctor if your baby isn't feeding well or doesn't have a strong sucking reflex. They like to be cuddled and handled. They may spit up from time to time, but if your baby is actually vomiting and or losing weight, call the doctor. Vomiting is not a sign of colic. They typically have normal stools. If your baby has diarrhea or blood in the stool, call your doctor. If you need a break from the crying, get friends and relatives to watch your baby and take some time for yourself. If no one is immediately available, put the baby down in its crib and take a break before making another attempt at consolation. If at any time you feel like you might hurt yourself or the baby, call for help on 0860 233 333. Gastroesophageal reflux occurs when stomach contents come back up into the esophagus during or after feeding. A ring of muscle at the bottom of the esophagus opens and closes to allow food to enter the stomach and opens to allow burping after meals. Vomiting may be caused by overfeeding or indigestion, or a sensitivity to proteins in the feed. Your baby may contract a viral or bacterial infection which can infect the lining of their stomach or intestine and can cause diarrhea, loss of appetite, abdominal pain, and fever. To prevent vomiting, try feeding your baby smaller amounts and burping baby more often. Don't bounce or let baby get too active right after feeding, and try to keep baby upright for about 30 minutes. Changing your baby's formula or your diet if you're breastfeeding. Getting your baby to sleep on their back. How is gastroesophageal reflux diagnosed? In a small number of babies, reflux is more of a concern. These symptoms include poor growth due to an inability to hold down enough food, irritability or refusing to feed due to pain from acid burning the esophagus. If your baby is vomiting or has a fever or diarrhea, they're losing precious fluids. Do not stop breastfeeding, but formula milk might aggravate the condition. It might be recommended that you only give breast milk, or if you are not breastfeeding, a rehydration solution. To rehydrate your baby, use an electrolyte solution available from most pharmacies as soon as baby is able to keep liquids down. Don't give your baby any medication unless it is recommended by your healthcare provider. Oral thrush is a fungal infection that usually manifests in and around your baby's mouth. Most babies have a milk layer on their tongue, but thrush looks like white spots or patches on the inside of their lips and cheeks. It's most common in babies of 2 months and younger, but it can appear in older babies too. You might have passed candida onto your baby if you're taking antibiotics while breastfeeding, have thrush and are breastfeeding, or had a bout of thrush during vaginal birth. Thrush makes your baby's mouth sore, and they may start crying when breastfeeding, sucking on a dummy or a bottle. It can pass through your baby's digestive system to their bottom and cause nappy rash. Visit your doctor, who may prescribe an oral antifungal treatment. Use a clean finger to apply some gel to the infected areas in your baby's mouth. You may also need to put some on their bottom if thrush has spread. Always wash your hands. It may take a week of treatment to clear up the infection. If you're breastfeeding, you will need to be treated with an antifungal treatment at the same time to prevent you from passing the infection back to your baby. Infant constipation is not the absence of bowel movements, but the passage of hard, dry stools. It often begins when a baby transitions from breast milk to formula or begins eating solid foods. Breastfed babies are rarely constipated because breast milk has the perfect balance of fat and protein. Rice cereal, usually the first food given to introduce solids, is low in fiber, which can cause constipation. If your baby isn't getting enough fluids, their system will absorb more fluid from whatever they eat or drink and from the waste in their bowels, resulting in hard, dry stools that are difficult to pass. Though it's uncommon, constipation can be caused by an underlying medical condition. Always discuss the matter with your healthcare provider. Here are some things to try. Massage your baby's belly. Give baby some exercise. A warm bath can make your baby relax so the stools are passed more easily. If you feed your baby formula, don't just switch brands. Always ask your healthcare provider first. If your baby is younger than 2 months, speak with the doctor first. If your baby is passing such hard, dry stools that they tear the delicate skin near the opening of their bottom, apply aloe vera lotion to the area to help it heal. Babies suffering from stuffy noses often find it hard to breathe, sleep, eat, and communicate. Try to remove any irritants that may be causing the congestion. Run a vaporizer in your baby's room. Use saline nose drops to loosen the nasal mucus. Elevate the head of your baby's bed to help the secretions drain. For babies under 3 months, avoid medicine. It could be dangerous without a doctor's recommendation. Crying is important for babies. It's their way of communicating and an important way to release tension. Learning to recognize the signs of hunger, fussing, smacking of lips, rooting, which is turning their head towards you, putting their hands in their mouth, will help you start your baby's feedings before the crying stage. Some babies will let you know right away when they need to be changed. Others can tolerate a dirty nappy for quite a while. It's sometimes difficult for babies to fall asleep. They may fuss and cry, especially if they're overtired. Babies need a lot of cuddling. They like to see and smell you, hear your voice, listen to your heartbeat. Gas, colic, and other troubles can be distressing. Many parents swear by over-the-counter anti-gas drops for babies or gripe water made from herbs and sodium bicarbonate. Always speak with your doctor first. Although your baby is crying and their temperature is soaring, a fever rarely causes harm and is part of your baby's defense against an infection. Contact your doctor straight away if your baby is under 3 months and has a temperature of 38 degrees Celsius or more, or under 6 months and has a temperature of 39 degrees Celsius or more. A fever is just a symptom of an illness and can mean your baby has picked up a cold or viral infection. Other causes include reaction to a vaccination, becoming overheated from being dressed too warmly, or spending time outside on a hot day. Your baby's skin will feel hot and sweaty behind their neck, or if they're younger than 3 months, on their chest and back. Other symptoms include poor sleeping, poor eating, lack of interest in play, lethargy, convulsions, or seizures. Test your baby's temperature with a thermometer. Normal body temperature is between 36 and 37 degrees Celsius, Here are some ways to keep your baby comfortable and speed up recovery. Keep baby well hydrated. Relieve baby's discomfort with a lukewarm bath or sponge bath. Let baby rest if they want to. How can I tell if my baby's fever is serious? It's better to be cautious and visit your doctor, especially if your baby is younger than 6 months. If there are other symptoms too, it could be more serious. Look out for sleepiness or drowsiness, refusal to drink for more than 8 hours, sunken fontanelles, the soft spots on their head, dry lips, dark yellow urine, and fewer wet nappies than usual can be signs of dehydration. An unexplained rash.
Good day, I'm Melody de Jager, and I'm the founder of the Baby Gym Institute, an institute that focuses on the brain development of every new baby. Congratulations being a new mom and new dad, because that is the most awesome time of your life when you get the opportunity to shape another life. We do a lot of research on brain development because brain development and the well-being of the baby is closely connected. Do you know, new mom or new dad, that the moment after conception, way before the heart is developed or way before the brain is developed, the skin develops. And there are 3 layers in the skin. The outer layer becomes the skin and the hair and the nails. Second layer becomes your intestines. And that means the second layer of the baby's skin becomes the baby's stomach and everything concerned with metabolizing food. And then the third layer becomes the baby's spinal cord and the brain. So for the rest of the baby's life, there's a very strong relationship between what happens to baby's skin, what happens to baby's metabolism, feeding, what happens to baby's brain development. Okay, so let's think of brain development and we think of what can I do as a new mom or a new dad to develop my baby's brain? In the first couple of weeks, actually in the first 2 months, there are a couple of things that are really important. The very first thing is that your baby needs to be relaxed, because a baby that's relaxed and who feels comfortable in his or her skin is a baby that's going to feed well. When a baby feeds better, metabolism is much easier. When feeding and metabolism is easier, sleeping becomes easier, and we've got a happy baby. And when we've got a happy baby, the endorphins are pumping in the brain. It's a baby that wants to move, because movement is how a baby's brain gets wired. But a baby won't move if a baby isn't a happy baby. So we want a happy baby that's a moving baby. If a baby is anxious, a baby's heartbeat is much faster. And the moment the heartbeat is faster, the breathing rate is faster. And when the breathing rate is faster and they start settling, they swallow wind. And when they swallow wind, it becomes very uncomfortable and they cry and they become anxious. What happens to you when you're anxious? Your mouth goes dry and your tummy pulls into a knot. Okay, the same happens to a baby. So we're going to look at how to massage a baby so baby feels comfortable in his or her skin, because if they're not comfortable in their skin and mom wants to hold baby to feed, they move away. We don't want that, because mom feels rejected. Don't want that. We want baby to feel comfortable so baby can come closer to the breast or to the bottle so baby can drink with ease. We want baby's metabolism to work well, so we're going to look at a couple of moves, baby gym exercises that we can do that really works well at stimulating metabolism. You need to massage your baby, not in any specific technique, but just touch your baby in a loving way from top to toe, as many times during the day as you possibly can, because it's comforting to them. You must remember, in the first 9 months, your baby was touched 24/7. 24 hours of every single day. The inside of your uterus and the movements of your body actually massaged your baby. Okay, so your baby is used to that. That's what the baby is craving. And the last thing we want to do is we want to look at how can we get baby to move in different ways so baby can ultimately reach its milestone. So I don't know if you know, but every developmental milestone is actually a brain developmental milestone. Isn't that awesome? Okay, so what does baby want soon after birth? It's for baby to relax, to feel you again, to smell you again, to be as close to you skin on skin as possible, because that's what makes them comfortable. And then we need to get baby to suckle properly, to feed properly. We need baby to metabolize properly. And then you have a happy baby that is growing and that is ready for some serious developmental milestones.
Information provided on this DVD is designed to be an educational aid only. It is not intended to replace the advice and care of your child's physician, nor is it intended to be used for medical diagnosis or treatment. If you suspect that your child has a medical condition, always consult a healthcare professional.